Okay, what is the basic difference between objective and subjective refraction, which is very crucial to understand by optometry students. Okay, so let's talk about objective refraction and then we will move to subjective refraction. And as I have already made the video on retinoscope, especially, and objective refraction is the examiner determines, just understand, the examiner determines the refractive status of the eye on the basis of optical principle of refraction without the need of subjective response. It's very important. Without the need of subjective refraction, if examiner determines the refractive status of the eye. So so on the patient of the eye, so on the part of the patient. So basically, patient's subjective response is not needed. An examiner find out the optical power or refractive status of the eye of the patient, then that's the objective refraction. Okay, so there are methods for objective refraction. So one of the gold is retinoscope, definitely retinoscope. But obviously nowadays the best and best auto refraction in the market. Definitely we consider keratometry, ophthalmoscopy, photorefraction also. But keratometry gives the cornea keratometry, isn't it? Cornea's power. So is very helpful to actually rule out astigmatism and all these things. Ophthalmoscopy, yes, grossly, but not that much. Autorefraction, very useful, and nowadays there are very good autorefraction. But definitely, it is retinoscope is far better if you are skilled optometrist. And photorefraction is also good choice in case of uncooperative pediatric case. Okay. So keratometry, as we know, as you have seen, and autorefraction. Nowadays, there are a lot of good autorefraction. Photorefraction, I will make one presentation, a short presentation on photorefraction, but not now. And let's move to the subjective refraction. What is subjective refraction? Now, objective refraction means the patient's subjective response is not that much of needed, very, very minimal. And in objective refraction, in subjective refraction means subjective refraction is method of determining most suitable lens prescribed with the help of response of the patient. So, with the help of a response of the patient, we optometrists determine the suitable lens prescription, which is basically subjective refraction is. Okay, so what Poloski 1991 tells. It is a technique of comparing lens against another, one lens against another, using change in the vision as a criteria, change in the vision told by patient, and to arrive the dioptrical lens combination that result in maximum visual acuity. That's the definition by Poloski. Okay, so its purpose is to find strongest plus. Just remember this very important when we are going to talk about subjective refraction in detail. Okay, strongest plus lens or the weakest minus lens, which allows the patient obtain the best possible visual acuity. So best possible visual acuity we want, but with what is strongest plus or weakest minus. That's very important point here. Okay, the both stimulates less accommodation or relax accommodation. So, subjective determination of the combination of sphere and cylindrical lens that artificially places the far point of the each eye at infinity. Do you remember one point that I have to? Let's take an example of this. If this is a patient's eye and her far point is here, let's say it's myopic. And what was the subjective principle of subjective refraction? If infinite from infinity, light came. The secondary focal point of a lens, correcting lens, must match with the far point of an eye. At that point, focuses at the retina, isn't it? That's what the principle, isn't it? Secondary focal point of a correcting lens must coincide with the far point of an eye. That's the principle of subjective refraction, isn't it? And in this condition, infinity conjugate with the secondary focal point of a spectacle, and secondary focal point of a spectacle conjugate with the far point of an eye. So far point of an eye conjugate with the retina. So that's why subjective refraction happens in this fashion. Okay, just remember these things. Okay, this is the combination of lens that provide the visual acuity with accommodation relax. That's why accommodation relax. That's why strongest plus and weakest minus. Just remember this point. This point, it will haunt you in throughout your life. Okay, as an optometrist. So basically, if we are talking about the type of the subjective refraction, we talk mainly on monocular and binocular subjective refraction. So monocular subjective refraction is performed with a contralateral eye and not being tested. One eye is only tested, okay? Another eye is occlusion. We have done another eye, we do occlusion. But binocular subjective refraction, that's quite tricky. Performed with both eye viewing the single target while one eye is tested. It's quite tricky. We test only one eye, but another eye is also open, not occluded, and both eye has a single target, not examining target, but the binocular periphery. Okay, we will discuss about it later on, but it's quite tricky. Both eye viewing the single target, but tested only one eye. That's quite tricky. Binocular subjective refraction is quite tricky, and there are few videos and few lessons you can see on the internet and all these places about subjective refraction. But we will definitely talk about binocular subjective refraction. Okay. So monocular subjective refraction, we have these things. Okay, we have these things. So basically, starting point, control of accommodation, monocular best sphere cylinder testing, under fog and without fog, monocular sphere ending, and spherical equalization. These are the steps in monocular, and definitely I'll take more than 2 to 3 4 5 videos to discuss this subjective refraction. Okay, till then today is not that topic. Today's topic is just the difference between subjective and objective refraction. So subjective refraction is monocular refraction. These are the steps just laying out. Okay, binocular refraction is a clinical procedure in which subjective refraction is performed monocularly under binocular viewing condition. That's the main point. See, subjective refraction is performed monocularly. That's similar with the monocular refraction, but both eye are open and both eye are fixing on a single target. That's why it's binocular viewing condition. Condition is binocularly viewing. Okay, that's the binocular refraction. It's central important. So just to lay out just few introduction, it's done by positioning septum. It's done by using polarized target. It's done by blurring vision of one eye such that its eye see only respective target. Okay, these are the three methods. So binocular refraction component procedure described monocularly are merely performed in the same or similar manner. So basically, binocular refraction component procedure described what monocularly are merely performed same or similar. That's a little bit different than the other thing. Okay. In conclusion, what is the difference between monocular and binocular subjective? Monocular uh, objective refraction and subjective refraction. Just it's simple. I'm just at 9 points and finished. By definition, measurement of the refractive without requiring patient's response is objective. By definition, measurement of the refractive error based on patient's response of the vision stimuli is subjective. Method: the instrument to assess the how light focused on the retina. That's the instrument, light, auto refraction, and all the subjective or retinoscope. Use tri lens phoropter or phoropter with patient's feedback on clarity. That's subjective refraction. So normally retinoscope auto refraction, and we have already talked about topographic or photo refraction. There are a lot of things for objective refraction. So in case of objective, we have trial frame, phoropter, duochrome, Jackson cross cylinder, and definitely there are a lot of method and a lot of charts used for subjective refraction. So subjective, this objective and this subjective. This objective is patient's cooperation is minimal. Okay, not no cooperation is quite difficult, but minimal. Yeah, in subjective, high cooperation and high attendance is very important. Speed usually faster, especially auto refraction very faster, but definitely retinoscope take times slower because initially patient must achieve the comfort out also. Accuracy, objective refraction may not match with the vision and accommodation media opacity. Accommodation media opacity and fixation issues creates objective refraction problem. But definitely, if vision comfort is there, subjective refraction is quite good. But ob- just remember one thing: objective refraction is a good starting point of subjective refraction. Okay, You remember always this thing: objective refraction is a good starting point of subjective refraction. Good, valid, and calculated starting point of subjective refraction. That's period. What is the meaning of objective refraction? Yet the fullest meaning is that, okay, the role of clinical practice: baseline measurement, useful non-communicative patients. Sometimes, if patient is not communicating, like example, patient is 8 months old, in that case, we can't do subjective refraction, isn't it? In that case, we have to rely on the objective refraction. So that's another use of objective refraction. The final prescription determined by with for the patient's cooperation. Limitations can affected by the instrument error or another thing, and not possible with patient with bare response. That are the limitations. Okay, so that's the subjective refraction and objective refraction. Objective refraction is a good starting point of subjective refraction. Remember always, subjective refraction is a power given to patients. Whatever spectacle you are wearing by subjective refraction. Its subjective refraction is way, way, way important. Okay, because the spectacle, final prescription, means subjective refraction. It's very important. It's very important. Most of the optometry students just always rely on learning objective refraction, that is learning retinoscope. Oh my goodness, how can I make very good objective refraction and a blah 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 blah. But that perfectly okay, you have to make objective refraction very good. You have to know how to do analysis and all this, and you have to know how to say that a little shadow in patient's eye from retinoscope. But the main goal, main player is subjective refraction. It's very important to do fine subjective refraction. Okay, okay. So today's reference is Boris, definitely primary care optometry, clinical visual optics, clinical procedure optics by J.D. Barrett. Okay, these are the four reference, and my favorite of all time is Boris. Okay, so I will start next presentation in object subjective refraction, definitely monocularly, then binocularly. Bistan, cheers.